that you've got on. Now the other thing for you that's good news is that we think it's the drainage routes in the back of your knee that are most affected from your knee surgery, which implies that the ones in your groin, the drainage routes there, are absolutely fine. So if we can just encourage all this fluid to move up and drain into those drainage routes, which is what this graduated compression's doing, then it'll all just drain away as normal then.
Okay, right.
Okay.
But I shall need to go on wearing a stocking.
Wearing the stocking, yeah.
Okay.
And doing your skincare, which you've been doing anyway, and being as active as you can. You know, obviously within the limitations that you've got with your other health issues.
Yes.
Yeah.
Quite.
Yeah. Now then, can you stand up for me again, and we'll just with that top bit.
So really, we're just trying to get past the popliteal bottleneck, aren't we?
Yeah.
And then everything should be fine after that. And the high level ones should function perfectly normally.
You want me
If
to
you
come
can,
forward?
yes, please, yeah. So really, this is quite a straightforward one, where, that's lovely, thanks. Where you sometimes run into problems is where you've got people, particularly after cancer treatment, they're more likely to have had groin node dissection and things after certain cancers. And then you've got to think, well, all right, so we're going to push the fluid up to the groin, but then what? Because it's not going to drain there. So those are the patients that then need to go on and do lots of massage to stimulate the drainage channels higher up. And they'll try and take redirect the fluid up to the axillary nodes and the cervical nodes at the side of the neck. You okay there?
I'm all right. Yeah.
Okay, I'm just going to finish this at the side of your thigh here so you know where it is if you do need to take that top layer off. Okay,
Right.
so that's that. What I want you to do now is have a walk across to the window and back, and just let's see how it feels when you're walking.
You're right about it gripping the carpet.
Yeah, it does stick to the carpet. You'll find you have to bend your knee and lift your leg a bit more than normal. That's it. But that's all good exercise too.
Yes.
Now, how does that feel?
That feels all right. Right.
Yeah.
I'm going to have to be very careful because I don't feel quite so steady.
Do you think your slipper would go over the top, and then you'd get a more normal feeling under your foot? We can try
Yes,
it, can't
we can. Keith, in the bedroom, love, by my chair, there's the red pair of slippers. Would you bring those in case they're easier to get on?
Yeah.
That's a good idea.
So ideally, Andrew, you want to be walking regularly throughout the day if possible.
Every couple of hours as a minimum, if people are fit enough. But even things like just leaning forwards in the chair and taking weight down through the legs, even that increases the pressure in the calf.
It's any muscular contraction really, isn't it?
Anything, any movement, doesn't have to be strong even.
Yeah.
Just movement is excellent.
Yeah.
Cycling my foot up and down.
Perfect.
That's good.
Okay.
Okay.
Yeah, you can't do too much waggling.
And also when I'm sitting down, lifting the leg while I'm sitting.
If you can.
If I can, right.
Bear in mind it's going to be heavier than normal as well. Yeah.
Okay, right. I did just wonder if they might be easier.
Oh, let's try. Thank you. No, we might do.
They might, okay.
Yeah. You're in there.
Is it in? I mean, I can't
think
feel
so.
it is, you see. So
It's more or less, it's a little bit shy, but it won't take long to go in.
No.
Because the other thing to think about is that this is very quickly going to decrease in size inside that bandage.
Mhm.
I mean, I've even had patients in clinic and I've put a bandage on just to quickly show them what it feels like when they can't decide whether to go for that treatment or not. And if I've taken it off half an hour later already, there's been some reduction in size.
Has that?
So this will very quickly feel okay.
Yeah. Okay.
Yeah, what you might find between now and when I come back next time is that because the swelling's going to go down, this bandage will just slip a wee bit. And what people find is particularly around the back of the knee. Now I've put a lot of padding there, so hopefully that should be fine. But just if it starts to ache a little bit and feel like it's rubbing, you can just pull it up a little bit from the top, but usually that's not terribly helpful. It stays up for a few seconds and then it shivers down again, but just see how you go, because you've got my telephone number anyway.
Yes. Yeah. Okay.
And I am working every day between now and then, so I can come back.
Okay. Right. You are.
Shall I swap your other slipper over?
Yeah. Yes, please.
Yeah. Can't have you without a matching pair.
No.
It shouldn't ever be painful. If
No.
it is, take that top layer off.
Yeah.
But sometimes what people do find is that if they've been still for a while, it starts to ache because the fluid just pools in one place. And usually just a little bit of movement sorts that out.
Yeah. Okay.
So
Right.
if movement doesn't solve it, take a layer off.
Okay.
But I think it'll be fine.
Right, you are. Thank you.
Okay.
Yeah. And what about putting the stocking on the other leg? I mean, we haven't this morning because I didn't know what you were going to say.
No reason why not to.
Right. Okay.
Yeah.
Because it's.
Because that's your normal routine, isn't it?
It's here. So. Oh, it's on.
It's here.
Shall we do it now?
Yes. Would you mind?
No, not so.
We'll
I'll
say-
save you a job.
Yeah.
Yeah.
I take it that's usually your job.
Yes.
Oh yes, it's completely his job.
I'd be interested to see it being done professionally.
I've actually ordered you a different stocking applicator as well to try.
What, as
because-
well as the one that's in the bag?
The one that looks like a piece of drain pipe.
Yeah.
That's the one I've ordered to try instead of this one as well.
So that'll
Just-
be for both legs eventually.
Well,
is it?
it's to see whichever you feel is most helpful.
I
Because
see.
this is all right, but you can't do this one independently, can you?
No.
Whereas
no.
the other one you might be able to, which is
Okay.
why I ordered that one as well.
Okay.
Okay.
Yes.
This is just a normal compression hose, or you, Andrew?
Yeah, this is a Venus one.
Yeah.
How long have you been wearing this one? Just remind me.
Well,
This predates me being
it's,
involved, you see.
it wasn't ever for one leg only. It's always been for,
For
both of them. So.
So is it something that your GP prescribed when your leg started to swell
Um,
a few years ago?
Yes, he did, because I'm sure I was wearing it before I went to see Mr. Ojimba.
Yeah.
Yes, it was.
Right, let's pop this on. I'll tell you what we'll do. We'll just pop that footrest back in because that'll just make life easier for me.
Yeah.
We'll just pop that one up. That's lovely. You all right?
Yeah.
Is this leg tender like the other one, or
No,
not as
no,
bad?
no, it isn't.
Oh, hang on a minute. That shouldn't be popping out there. I've been a bit too keen getting your toes down to the bottom there. That feels better.
Yes.
What I'll do is just pull that one round and get your heel in the right spot. There we are. That's it. Just get that away from your little toe.
Yes.
Does your little toe ever get stuck on that? Yeah,
It does.
yeah.
Keith has to be very careful freeing that before I start pulling.
There you go. Yeah, it's not so bad when you've got open toe stockings, but when you've got closed toe ones that are more
Yes.
like a sock,
Yes.
you have to be fishing around trying to
Yes.
sort it out. Right, yeah, that's okay.
Right, you are. Good.
Does that feel alright?
Yes, yes, it does. Thank
Yeah,
you.
just got it a bit high, let's just... There we go.
Okay. Thank you.
Now, do you want both your legs up on this stool again, or do you want to keep them down?
just- No, I'll keep them down for the
Mhm.
moment because it won't be long before we have lunch.
That's what I'm thinking,
And,
yeah.
Yes.
And in actual fact, once you've got that...
So this is 3 days later.
Yeah.
Uh-huh.
Andrea put the dressings on Monday. It's now Thursday.
Yes.
We're taking them off and seeing what's happened.
Did you manage to walk okay with the bandages on?
Yes, it was very awkward the first day, of course.
When it feels so
Yes.
tight.
Yeah. Felt extremely bulky, but
Yeah.
then it gradually became a bit easier.
When you're saying it feels bulky, look at the depth
Yes,
of that, you
there's
see.
there's a lot there, isn't there?
Yeah.
Gosh, it's lovely and warm. Pity to lose that warmth.
You'll miss that when it's not
I
on.
will indeed. We'll leave the central heating on, Keith.
Right. Now then, let's just ease that leg up. Is it any less tender under there?
Possibly, yes, I think it probably is.
I think you would have winced if I'd done that
yes,
before.
yes, probably would.
Yeah. Look, you've got wrinkles.
It's quite exciting, this, isn't it?
There we are.
Right.
Right, so that's the after.
Okay.
And when you compare it to this leg, not
Yeah.
that much difference in
No,
size
no,
now.
it isn't. It's not the same. The ankle is thinner,
Yeah.
slimmer. It is,
Yeah,
of course.
it is.
But it's a bit higher up.
And 29. Oops. And 36. So you've got to remember that now. 21, 29, 36.
21, 29, 36.
Okay. 21 and a half. 29. 36 and a half.
All implode.
Mm.
Yeah.
Just for the sake of a few days.
Yes.
That's it.
Yeah.
So, 21 and a half, 29, 36 and a half. I'm just going to check that the size I anticipated in your stockings is the right size before we
Okay.
try and fit them.
Okay.
I'll fit the stockings and then I'll take them off and then I'll show you how to use that applicator. First of all, I just want to check for fit
Okay.
and then we'll look at how you're going to manage getting them on and off.
Yeah.
Okay. Right, so we're going for a layered look now.
Yes. Yeah.
Because of the difficulties that you'd had with skin, really, wasn't it? Your skin was very thin and a bit fragile.
Yes.
Rather than trying to put a class 2 stocking on, what we decided to do was do a stocking liner, which gives you 10mm of mercury compression at the ankle, with a class 1 stocking over the top, which is 14 to 18mm of mercury. So you put them together and you get almost the equivalent of a class 2 stocking. So you get the compression that you want, but make it easier to apply and less damaging to
So
the
it's an
skin.
additive effect. You just add the two stockings together, basically.
Yeah.
Yep.
You all right there?
Oh, yep.
Where's that?
On
On the top there.
Yes, and a bit further my way.
Let's just pull that up. Just making sure that it's up as high as it needs to go and that we're not getting any bunching up round the ankle. Okay there?
Yes, that's all right.
Yeah. So where was it hurting when I put it on? Was it over this area and up here?
And a bit, yes, a bit higher as well.
Up there?
Not as high as that, no. Halfway between where the two No, come back a bit. Okay, there.
Right.
That's where it hurt a lot.
Now that's interesting because when you were wincing,
Mm.
actually the stocking was still down here, wasn't it?
Yes.
So maybe that's the position that you pulled your foot into,
Yes.
rather than the compression from the
Mm.
stocking itself.
Yes. Okay. Yep.
Right. So this one's slightly tighter, but it will go on easier because now it's going to be slipping over that layer.
Mm-hmm.
Okay.
Yeah. Mm-hmm.
So I'm just put your stocking so that the foot's inside out
Mm-hmm.
to start off with, just so I can make sure I get the heel in the right spot.
Yes.
You all right so
Yes.
far?
I'll put this leg down.
Oh, that's grand, thank you. You all right?
Yeah.
Just pull this one round the corner and up we go. Is that one more comfortable?
Yes. Yes.
Yeah.
Yes. That's all right.
Yeah, often that's the case when you've got a liner in, it just
Mhm.
slides on easier.
Yes.
Okay, so that's all looking like a good fit
Yes.
to
it
me.
is.
And it's just sitting just below your knee
Mhm,
there, so
yeah,
you're not going to get it gathering up in the back of your knee.
No. No.
Can you give your ankle a wiggle up and down? How does that feel?
That's all right.
Yeah.
I felt a bit of tenderness when you had your hand on a bit higher up on my leg just
Right.
now. But
But now I've
now you're
take my hands off
It's okay. That's okay.
okay. Right, that's grand. So we know that that's a good fit.
Mhm,
Now
yeah.
we've got to think about how you're going to get it on and off
Mhm,
when I'm not
yeah.
here to do it.
Yes. Yes.
Okay, so I'll just take this one off. And there's no secret way to taking it off.
So just
Just take it.
Yeah.
That's it.
Yeah.
Pop it the right way out again, so we're ready for round 2.
Mhm.
Okay. Now, the gadget I've brought is this one, and this is called an Easy As. I know you've used the ActiGlide as well
Yes.
before.
This is called a what?
Easy As,
Easy as.
because it's meant to be as easy as ABC
Oh,
apparently.
I see. Okay. Easy as. Okay.
Yeah.
Mhm.
So, what you need to do when you're doing this
Right.
is pop it with the heel on the stocking to the hole in the
Right.
back. So heel to the hole, it's the only way I can
Yeah.
remember it.
Yeah.
And just pop the top of the stocking over the top of the
Right.
gutter almost, and then just squeeze it down until you get to the point where you can see the knitting for the heel, which is more obvious on the top stocking than it is on the liner. So the knitting for the heel part is here.
Right.
Okay. Now the idea is that you can pop the
Oh.
foot into there
I see. Yeah.
and get the toes in the right
Mhm.
spot there,
Mhm.
and then just bring it round the corner. You all right there?
Yes.
And bring it up, and it's not actually putting any pressure on the front of your ankle, is it?
No.
As
it
that
doesn't.
goes on.
No, it doesn't.
Got that inside out, haven't I?
Uh,
Never mind, it'll be coming off again, so
It
you
will.
can have a go next. So that's the liner on.
Right.
So now we're going to do the same thing with the class 1 stocking.
Right.
So again, fold it over at the top with the heel towards the hole. Push it down till you've got the heel part just
Yeah.
up at the top here. I've got a little further to go. And I've got it a bit skewy. I'll just bring that round a wee bit. That's it. So the heel part's
Yeah.
here again. And again, over the toes. Now this one you need to just have a bit of an adjust underneath because it's a stronger stocking. To try and get the heel into the right place. Now it's not quite there, but what I'm going to do is push it up this way so that we've got the majority of it on, and then I can sort out the heel in a minute. Okay. Just pull that round the corner there.
Yes, yes, thank you.
Still comfortable doing it like that?
Yes,
Yeah.
right, it was. Yes, fine.
Now she'll find the difference.
Now it's over to you to have a go.
The film, Jimmy, so you can see the difference.
Like that?
Yeah. Yeah. So we can see that the left hand's really very swollen up, isn't it?
Yeah.
And it actually feels quite, it's feeling quite firm, isn't it? And then the swelling's going up into your left forearm, isn't it?
You're allowed to talk.
Am I?
Oh, absolutely, yeah.
There's a big
So,
tap
so
there.
it's only a video. Yeah. So again, we can see your left arm's quite swollen compared to your
Yeah.
compared to your right. Yeah. And how does it feel when it's swollen up like that, Jimmy?
It isn't that bad. It's just odds of times you feel it. It's
Yeah. Would you say it's pain or
like a
discomfort?
Discomfort.
Yeah.
And
Sometimes you have a bit
Yeah.
of pain, but
Mm.
most of the time it's.
just this dull ache
Yeah.
quite
Yeah.
often, isn't it?
Yeah.
And feels really heavy
Yeah.
and tight.
Yep.
Yeah.
Yeah. And this bit sort of, it is tightish actually today.
It is, but
tightish,
that
so
is a
isn't
lot
it?
softer.
Oh,
It's better than it was.
Than before we bandaged on
It's just gone
Monday.
down
Yeah.
a lot, like,
Yeah, so in
Yeah.
that 2-3 days of bandaging,
Yeah.
it's improved an awful lot. It's a lot
Yeah.
softer than it was.
Excellent.
Okay.
So what are we doing today, Andrew?
Well, we're going to re-bandage
Yeah.
with a multi-layer bandage. So the
Uh-huh.
first thing you need to do, Jimmy, is put your moisturising cream
Right.
on, please.
There's one.
Hang on a minute. Is it?
You got it. No.
No?
Turn it. Which way is it?
That way.
Ah.
Got to have a nap.
I must be getting weak.
That's just the dipper base, Andrew, isn't it? Just to
Yeah, just as an emollient.
moisten the
protect
skin, yeah.
and reduce the infection risk.
Does it?
Yeah.
Mm. It's more, yeah, you're
Yeah.
not going to get, bugs can migrate through dry, cracked skin.
Yeah, exactly.
Yeah, yeah.
And because he's not going to see his skin now to put more moisturiser on until I come back again in 3 days' time, it's really important that he puts plenty on.
Mm.
And what I find with Jimmy in particular is because of the nature of the jobs he does are quite often physically hard and dirty jobs, then we have a lot of problems maintaining the skin integrity around the fingers and the fingernails.
Yeah.
So, but this is, in fact, they're really in the best condition I've ever seen them now.
Mm.
Because they were really dry, your skin was sort of really hard and thick and, and really cracked, wasn't it?
But when it's cold and wet, that's what's down with
Yeah.
half iron anyway.
Yeah,
You know?
yeah.
Mm.
Keeping them dry when you
Yeah.
working on that.
Okay, now I'm just going to come round here to put
So with
this
that
on.
simple intervention, you've reduced the risk of cellulitis.
Yeah.
Yeah.
Yeah. And on some patients who have really stretched, fragile skin and you don't want to put compression on because they wouldn't tolerate it, just doing simple skincare measures can reduce their incidence of cellulitis and improve the skin condition no end.
Yeah.
Yeah.
Yeah. Mm.
Right, this is going to be a bit of a stretch. Okay. So, put mine on there, that's it. So this is just a tubular stockinette bandage, just as a layer between the top layers of bandage and the skin.
Mhm.
Because what we find is that sometimes patients, particularly who've got sensitive skin, will find that the wadding that we use is irritating to the skin. So this is just a protective layer.
Yep.
Not really adding to the compression as such. So
Yeah.
Okay. So I'll just pull that up a little bit more, Jim.
I'll let you finish that.
That's it, yeah. Okay. So I'll just flip this back that way. Now, when I bandaged on Monday, there was quite a bracelet effect here, and so I actually put some extra padding and wadding around here, but I don't need to do that today because the shape is better.
Yeah.
So what I'm going to do is go on and bandage the hand and the fingers. So this is just a stretchy, cohesive retention bandage.
Mhm.
And I'm just going to wrap that round the wrist to secure it. And then bandage each of the fingers in turn, just always approaching the finger from over the back of the hand, the dorsum of the hand. And a couple of turns round the thumb there. And anchor in turn again around the wrist. And then just do each finger in turn from the fingernails up to the base of the finger.
And what would happen if you don't do this, Andrea?
What would happen is if you started with the compression bandage from the knuckles, you'd end up with a layer of pressure here,
Mhm.
no pressure on the fingers, and then you just end up with very swollen fingers.
Yeah. And of course, that's going to cause ongoing problems in the fingers. That's going to cause fibrosis and complications.
In
isn't
the
it?
long term, it would, yeah.
So you could actually be doing harm by
By using inappropriate
Yeah.
bandage
Yeah.
techniques, yeah.
yeah.
But you don't, in most cases, want to be using a compression bandage as such on the fingers, because that would give you far too much compression, and,
Yeah.
and it could be harmful. You could
Yeah.
end up blocking the arterial circulation.
Sure. Yeah. But in practice, you find just that bandage is enough to stop the fingers from swelling up.
Yeah, for most cases, yeah.
Mhm. Just that bit of support, isn't it?
That's all it is,
Mm.
yeah. Another thing to be aware of when you're doing this is that you don't get too much pressure upwards from your bandage, because that
Right.
would dig into the web
Mhm.
spaces and cause
Yeah.
breaks in the skin. So you've just got to be careful how you apply the pressure. And you can always put strips of wadding in between the fingers as well.
Mm.
That just makes it more fiddly to
Mm.
apply and more bulky for the patient. So
Mm.
if I can get away without doing that, I try to.
Yeah.
So that's the fingers bandaged.
Mhm.
Now we're going to put some wadding on, and this is just to try and even out any shape distortions.
Yeah.
So what we need is a bandage that's going to be narrower at the wrist.
And progressively
and
thicker as it goes up the arm.
That's it, up towards the top of the arm.
And that's what gives us the graduated compression.
Yeah. But because Jimmy's got a very big hand, it means he has to have an awful lot of wadding on.
Right.
And also you'll notice that there's much less swelling up in the
Yeah.
upper arm, which again means it proportionally he's got to have a lot of wadding on there as
Yeah.
well to bring the size up.
So why is that, do you think? If the problem's in the thorax, why do you think it's the lower arm's more swollen than the upper arm?
I knew you'd ask me that. And the answer is I'm not entirely sure. I mean, some of this forearm fluid will be draining, rather than into the axilla, it will go into
Yeah.
the cubital fossa.
Yeah, yeah,
But then what difference that makes once you're getting into the thorax,
yeah.
I don't know.
I suppose
Unless
in the
it's-
upper arm you've got the biceps contracting, haven't you? So you've got a lot of
Yeah,
You've got a lot of,
you've
pressure
got
being
forearm
generated.
flexors and things
You
down
have,
here,
yeah.
and
Mm.
you know, I really don't know. The only thing I can think of is that it goes back to these collateral roots and does the route from the cubital fossa somehow bypass
Yeah.
the axilla and go somewhere
You've
else.
probably got larger vessels going up from the elbow up to the up to the axilla. But that's what keeps it interesting, isn't it?
Yeah,
We don't know everything.
absolutely not.
Mm.
Wouldn't life be boring if you did?
It would.
So you'll notice I'm not putting much more padding other than just a single layer over the forearm. I'm going to
Because
put a
you-
little bit
you
more
wanna
on
keep
because of
that thinner.
the size of the
Yeah.
hand there, but
Mm.
I'm really concentrating my efforts with the padding on the upper arm.
Yeah. It's sculpting, isn't it?
Yeah.
You're getting the shape that you want.
I'm an artist.
Yeah.
That's it. That's okay. So now we've got the shape that we need. It's ready now to take the compression bandage. Just move these down where I can reach. So same as when we looked at the leg bandage, we're starting off with a small bandage for the hands now.
Which is going to apply, because it's going to apply more pressure.
Yeah, So the short stretch bandages come in 4, 6, 8, 10 and 12 centimetre widths. On most hands you'll need a 4 centimetre one, but Jimmy's got such big hands that we're going for a 6 centimetre one. But it's dictated by the depth from the web of the thumb to the start of the knuckles, and you can see if I put that on me, it will be coming halfway down my fingers, but it certainly won't do that on Jimmy.
Yeah.
Okay, so it's a fix and turn around the wrist without any compression on.
Right.